Hi, I'm Stephen Hand from Archery Supplies. 2 weeks ago, I was running half an hour on a treadmill. I was shooting a 56-pound recurve, and I was feeling pretty good. And 2 weeks ago, I had bypass surgery. Now, first thing you'll notice in my voice is a little bit weird. So I want to go through bypass surgery, what happened, and just all my experiences. I want to talk about the nurses, the doctors, people in my ward. So if you have to go through this, you've got a bit of an understanding of what you've got coming up and how you're going to feel. Okay, so I first off went to hospital and they found a blockage and the doctor said I needed bypass surgery. So he said, you've got 2 weeks to get as fit as you can. So I was on drugs and I was on double blood thinners and then swapped to single blood thinners closer to the time of the surgery. Now the single blood thinners, basically all my strength came back and I could exercise. I changed my diet completely and I was feeling really, really good. Like running, walking, 30 minutes on a treadmill, where previously I couldn't walk 100 meters. So it was a huge, huge change. So I said to the doc, well, maybe I don't need this surgery because I'm getting better. He said, no, you need the surgery. Oh, that's disappointment, right? So now the doctor said, I'm going to feel shit. I'm going to feel like a truck has hit me for the first 3 months. And that's about as much information as I got about bypass surgery. You're going to feel terrible, and after that, it's all going to be fine. Okay. Now they do tell you there's risks with all surgery and you've got to sign a bit of paper and that's all good. Now, so I suppose I'll start off with going to the hospital. So you go to the hospital the day before the surgery. You've got to, well, they shave you down. So there's no hair on your body, and that doesn't mean your head, but I shaved my head as well. Now they do that because they may need to get a vein from your leg or your arm for another piece of your body if the vein's no good. So that's why they do it. So you go in the day before. When you go in, I had shaved down before using not a razor, just like a hair groomer, because I thought that was helping the nurse. The nurse said that didn't help the nurse, but anyway. So you get in there, the nurse puts sheet on the bed and cuts your hair off, whatever hair you've got left. And that's fine, very professional, underarms, everywhere, right? You then shower with a special soap, and then they wake you up at 5 o'clock in the morning and you shower again. Okay. Now you've met with the anaesthetist, he tells you what's going to happen. He said, look, you're going to go out pretty quickly, so, and then you wake up and life will be fine. I don't even remember the anaesthetist. I remember getting woken up at 5 o'clock in the morning for the shower. You shower yourself with this special soap, but I don't recall anything after that. That was it. I went back to bed. I think they put a mask on. I think that was to relax me, and I obviously fell asleep. And basically, I went in for surgery at 7 o'clock in the morning. So, at 7 o'clock in the morning, I'm first up for surgery, and I'm out of surgery at 12 o'clock. Apparently, the surgery went perfect. Now I'm in ICU at that stage. Now I don't recall the time. I have very limited understanding of ICU. When I say limited understanding, when I woke up in ICU, there was a nurse next to me, my sister was next to me, my girlfriend was next to me. I was moving at this space. Like I had no idea what was going on. My mouth was really dry. I felt no pain. My back of the throat was a bit gritty. and they were putting little chips of ice on my tongue just to let moisture settle in my mouth because my mouth was very dry. And I felt very relaxed in ICU. I looked around. It was a big ICU unit. I couldn't see anyone else there. There was probably 10 to 12 beds for ICU, and I couldn't see anyone else there. So whether there was or whether there wasn't, it was a big room with all different rooms in it, but it was very quiet. Anyway, from waking up in ICU, literally I'm feeling relaxed, and one of the nurses goes, "Oh, you can go to the ward now." So then I'm shifted to a ward. Now, I do not recall moving from ICU to the ward. I just remember feeling relaxed in ICU, and then the nurse going, "Oh, you're going to move to the ward." And I was like, geez, I've been in ICU for like a couple of minutes. But it may have been longer. I have no concept of time. I think I moved to the ward at 7 o'clock at night, but I have no comprehension of it whatsoever. So at this stage, I've really got no concept of what's going on, or basically anything. So I wake up in the ward, and I don't really recall much. But I tell you what I recall, and that's the people in the ward. So I'm in a ward with 4 people. And 4 people well, I wasn't crying. I wasn't in much pain at all. But they were crying. Lots of complaining. So I'm going to talk about the patients in there, because for me, that was my sense of independence just broken. I couldn't stand up. I couldn't move. I couldn't say anything. It was like I just felt, I'd say I felt a bit depressed at that stage. So anyway, in the one corner, there's this old girl. I'm going to say she's about 90 years old. She may be younger or older. She'd fractured her bum. She'd fallen over in the shower, sitting on one of those seats in the shower, and fractured her bum. She didn't want to be in the hospital. She wanted to be moved to a private hospital. She didn't like the nurses and kept telling them so. The nurses would come in and say, "Oh, what's your pain level?" And she'd say, "You're joking, aren't you?" And they're like, we're trying to help you. And she goes, "You can't teach. Who taught you to nurse? You're no nurse." And the physio would come in and she'd yell out and she'd go, "Don't you touch me." And I was like, so I had to put up with this for about 2 to 3 days. The lady was very rude to the staff, and the staff were lovely. I couldn't believe how lovely they were, because I would have tersed her and said, "Stuff you." But the staff has said, "Look, we're really sorry you're not happy with our nursing. We're trying our best. We know you don't want to be here, but the other hospital has no beds." So anyway, after in 3 nights she was there, and in 3 nights, in 3 days, I don't recall anyone visiting her, but I recall the moment she left, and I was relatively happy. The bed across from me was a guy who had the same surgery I had. Now he was getting around a bit, so he'd get up in the morning, walk around, and then basically collapse. So that wasn't great. So I didn't know what's happening with him, but I'm watching because I'm like, well, is this going to be me? So he would get up, walk to the bathroom, which is about a metre, come back to his bed, and he'd be pretty good, and then he'd just be out for the afternoon. The bed next to me was a guy who fell off the roof of his house while trying to fix his air conditioner. Well, he was in tears the whole time. Complain. Now, I'm not sure what the pain level is that he was on, because when the nurses come in, they're always like, "What's your pain level?" From 0 to 10. And I found that very hard. I don't know what level I'm at, so I just figure I've got to make it up. But Oh, he complained all the time. Um, but it was weird because he's like, I'm in massive amounts of pain. I need lots of painkillers. But then he seemed to have no pain, so it didn't make any sense to me. Um, Now his wife came in. His wife came in, so I'm sharing his nurse. So a nurse will look after 4 patients, and his nurse and my nurse were the same. So the nurse comes in to help him get up, and his wife goes off with the nurse. So that was the last I saw of my nurse for that day because she went off at the nurse, which I was very grateful for. Obviously not, for her being so rude. But, maybe she's justified in doing so, I don't know. But I was just like, I wouldn't want to be a nurse. People are rude to you, and I think the nurses are doing an amazing job of looking after the patients. They clean the beds, they clean the windows, they clean the bathrooms, and they literally do anything for you. So if you want a drink, you've got to ask the nurse. But anyway, so he left about 3 days later. Now I would say he had no broken bones. He had a few mild fractures, and they moved him to the normal medical ward. So I'm in a cardiac ward for people with cardiac things, who've had bypass surgery. But what they do, because the hospitals are full, if there's a spare bed, they put any patient in that bed. Okay, so and then they allocate them to a room which is more suitable for them at a later date. So he was there for 3 days. Okay, so in the far off bed, I get a Greek guy. His name's Manu. He comes from Darwin. He's a big guy. He's 44 years age, and he's big. He's 150 kilos. He's twice my size. He's big. He works on a ship, and he's there with his brother from Brisbane. Anyway, Manu doesn't sleep, and his wife is in Greece. So he's been in Australia for 2 years working on ships, and he's had needed a heart bypass. So all night, Manu speaks to his wife on the phone, full bore. So between the talking on the phone, drug tests at night time where they're putting drugs into you, taking blood from you, weighing you, because they seem to weigh you at about 3 o'clock at night for some reason. It appeared to me I was woken every hour. So it was basically trying to get sleep was impossible in hospital. It was terrible. So anyway, so Manu's on his phone to his girlfriend, wife, every night. Not during the day. I assume that's because of the time difference. And then I've got, the guy next to me, he's gone, so he stopped crying, so that's all right. I've got another lady there, an old lady who's had cardiac surgery next to me. Now, she seems fine. She's like 85, and she's got cancer, cardiac surgery, and she had plastic surgery at the same time. And she seemed fine, and I'm like, that doesn't make any sense, because here I am young and fit, and I seem to have problems. Anyway, so that's my ward. Now it does change. The guy across from me, he goes into rehab because he lives at home by himself. So he has to go to a hospital for someone to look after him. He's replaced by a couple from Darwin for cardiac surgery. Now I'll talk about the public hospital. They flew him down in a private hospital plane with 2 nurses, 1 doctor. Cost $64,000, all free. It's an amazing service. He's depressed. He's refused service at this stage. He's been in hospital 3 weeks, and he wants to get out. And so he's depressed. So this is what I'm kind of in the ward. It's not a ray of sunshine, and I haven't seen any sunshine. So that's what you're dealing with, and that's why I want to talk about the ward, because if I had a choice, I'd choose a private room because I don't want to deal with people's phone calls. I don't want to deal with the guy next to me crying. I don't want to deal with him abusing the nurse. I don't want to deal with her abusing the nurse because the nurses are lovely. So, and you know, like, and I feel like if I was better, you'd say something, right? You'd get up and say, you know, be nice to people. But at that stage, you really can't talk. You're kind of bed bound and you know, anyway. So for me, I was like, I don't know. I felt like I wanted to defend the nurses and anyway. So I want to talk about the first night back in the ward. Now I had nightmares. I had the weirdest nightmares. And I had nightmares about these huge hearts and machines and me trying to align them to get them to work. And basically, whenever I'd fall asleep, I'd have the same dream. That if I didn't get these hearts to align, these machines to align, then I'd die. And it was scary, and I'm getting woken up every hour by a nurse to take my blood, to infuse stuff into me, to take blood pressure, to go to the toilet. So it's every hour you're getting woken at night time. You get woken more at night time than during the day, which is crazy. But anyway. So the first night I'm having these dreams. Now they say that's normal. And everything I go through, they say it's normal. So the next night, I start waking and I have dreams that I can't breathe. So I wake up and I feel like I can't breathe. So I feel like I feel like I can't breathe. So I take deep breaths and calm myself down because I'm panicking. Those dreams last for 2 nights. So really I didn't want to sleep for the first 3 nights. It was pretty terrible. And they say that's the effects of the drugs and basically just your environment around you. So I was obviously thinking about, you know, struggling to breathe. But that's what I was thinking. So what happens to me then? So I'm thinking, I mean, originally the doctor says I'll be out in 5 days. And I'm going and I'm doing walks. Now I'm only allowed to walk on my floor. So I'm only allowed to walk on my ward, on my floor. So originally they're like, we're going to have you doing flights of stairs and all this. None of that ever occurred. So it was very hard to get up out of bed. When I get up out of bed, it hurt my chest. I finally learnt to elevate the bed, to put the bed in that angle, to prop me up, swing my legs over and get out of the bed that way. Because originally I was just getting up and every time I was hurting my chest. Right now I'm sleeping in a recliner chair at home, but just trying to reduce the pressure on my chest because that's all been cut open obviously. So in hospital it was going okay, and then my white blood cell count started going up, which would indicate an infection. So then they're pumping antibiotics. So you've got a drip in your neck, a drip, a plug, where they can take blood and put blood in, and also one in your arm. And these things are pretty good because they don't have to jab you all the time. So anyway, they've got IV antibiotics coming into me literally all the time to keep my white blood cell count down. Now I'm still on antibiotics today for it, but as I understand, when they released me, it had stabilised, so hence able to leave hospital. Now one of the things that did change in hospital, because they take so much blood. It's like one day they took 7, 8 vials of blood, and that's the day before I left hospital. So my potassium and magnesium levels were down. Now I believe this is quite normal from this operation, because out of the 4 people in the ward, 3 people were having potassium magnesium put into them with bags of IV liquid. The IV liquid, each bag takes about an hour to go into your system, and they give you another bag. So you're basically out of it for about 5 hours. And when I say you're out of it, you're not asleep, but you can't do anything for 5 hours. And the problem is you're on drugs which make you want to go to the toilet. So it's trying to get liquid out of your body. So while they're pumping liquid into you, you're wanting to go to the toilet, but you're hooked up to an IV system. So between IVs, where they plug in, I go to the toilet. So anyway, so that's all right. So you get used to having blood taken, because it's going to be all the time. The last time I had problems, my arms look like pin needle cushions from all the things, and it's just like, what choice do you have? You've got to do it, right? So lots of IV, lots of drugs. Now, I hadn't been outside. What I was doing for my exercise is walking around an elevator. So it was an elevator about 3 meters by 3 meters. I would walk circles around that. And it was terribly boring. I wasn't allowed to go downstairs. I wasn't allowed to do anything. I wasn't allowed to go outside. Now, I was allowed outside if I had a visitor, and I was completely grateful when I had a visitor and I went outside. Now, the other thing, if you're having this, it's more than common to be emotional. And I don't understand why, but I would just... Now, I wasn't crying like the other guys in the ward, because I could hear them crying, but it was just like emotional, and I don't know why. I have no idea why. But like, I'd go outside in the sun, and it's a sense of relief to be able to feel the sun. Because I feel the sun heals me, and I feel trapped inside, because I'm just either in bed or I'm sitting in a chair next to the bed. I can't see outside because I don't have a window view. It's very depressing. So, but I did big walks with my partner outside, but I wasn't allowed out because high white cell count, and then they detected I had a problem with my liver, which we'll go into. So then the surgeon suggested we cut out my gallbladder. I'm not real keen to cut out my gallbladder, because before going into hospital, my body was pretty good. So everything was good. So since I've come home, I'm doing research on it, and they say it's more than common from Panadol affects the gallbladder, and so does antibiotics. And I've been on massive amounts of antibiotics and massive amounts of painkillers. Now, I didn't understand when I'm in there, because I generally don't use... I've really never been to hospital, and I don't use painkillers. So I didn't understand the difference between like Panadol and Endone. Endone's a high painkiller. Takes away a lot of pain. I didn't understand the difference. Different painkillers are processed by different parts of the body. Panadol is processed by your liver. So if you have a liver problem, you can't have Panadol. So I had a liver problem, so therefore Panadol was cut out of my repertoire. Now, I'll talk about the drugs. So when they give you drugs, I was allowed to have Endone every hour. I didn't. I had generally 1 tablet a day, sometimes 2 tablets a day. But at the start, they were just like handfuls of painkillers. And I feel like the problem with handfuls of painkillers is you can't feel anything. So you feel good, and it's probably not that beneficial. So anyway, I think I was probably getting 3 endones and a couple of Panadols at the start of it. But that was, yeah, there was a lot of painkillers at the start. But I felt no pain. So I want to talk about the pain. So to get up and get down from bed hurts here, and I could hear clicks going on. The clicks have all gone away now. I'm still sleeping in a recliner, as I mentioned before, because getting up and getting down is the biggest form of pain for me. And I haven't taken any painkillers for 3 days now, just because I want to avoid it. Here, on my chest, it's swollen. Apparently that's normal. And it's swollen about that far out. It feels like a steel plate on my chest. It feels like a steel plate that big on my chest sitting there. Look, it doesn't really hurt, but you notice it. It's a bit annoying. They say it goes down after 12 weeks. Okay, I want to talk about the nurses in the ward. Now, the nurses in the ward are amazing. Absolutely amazing. And you generally see the same nurse all the time. So you'll have 3 nurses a day generally, sometimes 4. And they'll generally put the same nurse with you repeatedly. And I would say they are amazing people. The head of the nurses, the head of the ward, was a bald guy. His name's Steve, and he looks a bit like Steve Austin from wrestling, bit bigger. Okay, he must be towards 7 foot. He's a big, bald guy. He's big across the shoulders, and he's a gentle giant, and he runs a tight ship. So as soon as the bed is empty, he's got the nurse coming in there, cleaning it, getting it ready for the next patient. And that bed, from the time it's empty to the time of the next patient, may be as little as 20 minutes. It's quite amazing. But he's literally on it all the time. And you see him, even though he's the head of the nurses, he's there doing the work. So he's there. I saw him clean the bathroom. I saw him doing stuff. I saw him, like, he's just kicking in where he needs to. So that's very good. Now, there are more male nurses in the cardiac ward than there are female nurses. And I'm going to say the male nurses are extremely proficient. Now, I'm not saying the female nurses aren't proficient, because the more senior ones are amazing, but I had a sense from the boys that this is their career. One of them had been a mechanic, then a school teacher, and now he's a nurse. And they just did, and I say everything, and they do everything well. And they listen, they take directives, where some of the female nurses didn't want to take blood, some didn't want to do other things. So in one case, with this little bung in my neck, it came out. So I've got blood spurting out, right? And I say to the female nurse, I'm like, I've got blood coming out, and the blood's all over my leg, right? And she's like, oh. So she's dabbing the blood on my leg. I'm like, no, it's coming from up there. And she goes, oh, I don't know what to do. So she goes and gets a male nurse. Now, I'm not saying the female nurses aren't good, because there's so many good nurses there that you can't, like, it's just unbelievable. And I think the key is that these people have been there for such a long time. They're understaffed, so a lot of them are working double shifts. So instead of working 5 days a week, a lot of them are working 6 days a week. And I think some of them are working back-to-back shifts as well, just to help out, because there's no nurses. But extremely professional, and it's so good to see males doing extremely well in a highly female-dominated industry. It's they were so professional. Just like, so I've got to get jabs in the guts, jabs in the guts. I've got to have these injections to stop my blood clotting. So Blake is my nurse, and he comes and gives this. And now, before when I've had nurses, this hurts like heck. Like I would be bruised the size of my fist, and it would be swollen. Anyway, Blake comes in, gives this jab. I don't feel anything. I'm still like bracing for it to hurt, but I feel nothing. I don't know what he does differently, but very, very good nurse. Now, there were some female nurses who are very good as well. But there's some other female nurses who are not so good. But he's a very professional nurse. I'm going to say he'll have a big career. Okay, so where else are we up to? Okay, so what does it feel like to... So I felt like I had mass depression in there. Now I'm grateful to be there. I'm very grateful for the nurses, the doctors. The doctors do their rounds every morning at 8 o'clock. They mess around with your drugs, more blood tests to see how those drugs affected your blood every day. That seems to be the thing. You feel like a guinea pig. But they're doing the same thing on everyone. So anyway, my stomach is completely bruised from all the injections. My arms, my hand, where they had to take blood from, because they couldn't get blood from this arm, they couldn't get blood from this arm. They had to take 5 vials of blood. The blood stopped at 4. So the nurse said, "Is that enough blood?" I'm like, "No, you've got to do the 5 again." So they had to take it from the back of the hand. But that's what you've got to do, right? Okay, so let's talk about how I feel. So, hard to talk. His talking is pretty good now. So this is 2 weeks. It's pretty good. I feel like I'm getting more colour. I think I look terrible. I've lost 8 kilos of weight. So that's about 8 kilos of weight. 20 pounds of weight in the process. And I feel like I've lost all my muscle. I've got flexibility, my ability to move my head from side to side. Originally when I go to hospital, that was hard to do. So I've been working on that. I generally have a pain in my back from sleeping. So I've got to stretch to try and do that, but that hurts. Like lifting my arms up, that's it. There's my hand. So I'm getting my arms not to 90 degrees, probably to something like that. Now some people are different. Some people have got more flexibility. I'm going to say I'm using button-up shirts because you're not meant to use a t-shirt. So when I brought these cheap shirts, $15, and you just sort of slide them on. They look fine, and you're not hurting your body in the process. So now I'm on lots of meds. Meds to thin my blood because I've still got blood clots, obviously. Antibiotics, things to lower blood pressure, control my heart rate, can control cholesterol, reduce water on the heart. I think I'm on about 10 in the morning and 4 at night time. So I'm really looking forward to being off that. I need a test next week on the liver. I need to meet with GPs in 2 weeks about getting this gallbladder cut out, but I'm not keen on that until my body's settled. Well, I'm not keen on getting my gallbladder cut out. I'm going to say that. I want my body to heal. Now, I used to feel nauseous when I ate, so I was eating smaller meal sizes. I'm going to say the meals in hospital were not great. They were just not very good meals. They were cold, not very nutritious. So much happier at home. I'm sleeping more at home. I am, I feel more in control at home. So I just feel more, I, look, I'm not going to race a 99-year-old with a walking frame because he's going to kick my ass. That's how slow I'm moving. I can't lift anything. I can't shoot a bow. It's a beautiful day. I'd love to shoot a bow, but I can't. I can't lift my arms. And, you can't, like you're not allowed to, but I can't lift my arms. So that's going to come. Now, yes, you've got to do all exercises to increase this. And when you do the exercises, you're buggered. It kills you, and then you need to go and sit down and rest. Now, the other thing that happened, my eyesight went really poor, and that's apparently more than common as well. So, so reading was really hard, and I get exhausted doing little tasks. So if I've got to look up something, it just wears me out. So, so I'm not sure how that all is, but it's 2 weeks. It's 2 weeks, and I always go back. So where I've got my blockage, it's the same place my dad had his blockage, and he could have had this surgery and he'd be alive today, but he chose not to. And it is a very hard surgery. Some people say there's harder surgeries. The nurses looked at me when I said that and they're like, this is big. So look, I'm not saying I've got the biggest car or I've had the biggest surgery. I'm just trying to give a bit of insight into how you feel. If you're going to do it, make sure you've got a recliner or something. If I had known about this stuff, I would have brought an electronic recliner for my house. To go, press the button, zzz, back, zzz, up. Where mine now, I need to use my core to do it because mine's just a manual one. Oh, so much harder. $2,000. You can pick them up on Marketplace for a few $100. I would have brought one if I would have known. The thing was, I had no information. People say, yeah, I had this operation. But I think a lot of the times people forget about all the pain they were in. One of the nurses had this operation at 42. She hired an electronic bed that moved up or down for 3 months, she said. That helped her. Now I'm going to talk about the patients in the ward. 16 patients in the ward at any one time. About 80% of them will be male. We had a high number of people from Darwin because we obviously have a contract with Darwin to do their patients. We generally had 2 Indigenous people, which is a very high number in the ward for cardiac surgery. And so now the lady next to me who was doing okay, who seemed to be what's the use of exercising, because she's doing fine without exercising. On the last day when they were meant to release her, she had a few issues. So I was actually released before her. But before that, she was doing okay. No pains in her back, nothing that the rest of us were going through that seemed to be common issues. So, my summary, if you're going in for cardiac surgery, I would be very thankful that you are. Get your body in a shape that is the best it can be. They'd be doing core strength on your gut, your legs, because you're going to want to do those exercises to get in and out of bed. You're going to be able to want to do that and have the best diet you can. And when you get home, if you've got someone to help you, I don't even know how you'd manage without someone at home to help you, which is maybe why they send people to rehab. um, because the first few days you're disorientated, you struggle, like you struggle lifting your arms. It's all very hard work. Anyway, I will do more videos on archery. I'm interested to see how long it takes me to lift my arms to a stage I could hold a bow. I do find it completely incredible that 2 weeks ago I could run 30 minutes on a treadmill and I felt strong, I felt young, and now I feel old, I feel gaunt, I'd say I feel sickly. And when I look at myself, I see my grandfather who had cancer. And I don't have cancer, but just the look in the face, it just doesn't look good. So anyway, I'm told this is all normal. And I'm going to say thank you to everyone the number of people who messaged me, wished me well, sent me prayers. Unbelievable. I got a book from a friend in America, from a friend who passed away. Like, for someone in America to think, I'll send Stephen a book. Why is it? And I haven't read it because my eyesight's bad. They say the eyesight will return, so once all the drugs are... I think the eyesight's already getting better now, but they say it will improve. Anyway, huge thank you to everyone. I just hope it's beneficial. They say after 12 weeks, like, life is just normal. But I will do ongoing videos to sort of show how it is. One of my friends, cousins, said after the 6-week mark, it's a rapid improvement. He said the first 6 weeks, it's pretty flat, and then after that it shoots up. So I'm interested to see how it goes. Today I feel significantly better. I'm Stephen Hand from Archery Supplies. Thanks for watching.